Personal care workers help their clients bathe, get dressed, eat, anything they need in order to keep them living in the comfort of their own homes.
But a statewide shortage of those workers is making it harder for area agencies to provide those necessary services. News 8's Madeline O'Neill is here with more.
Martha and Mike, several local agencies say finding personal care workers has become a huge struggle over the past few years because it's a hard job and they just aren't able to offer competitive pay. Governor Scott Walker's proposed state budget increases Medicaid reimbursement, which agencies use to pay workers and cover overhead costs. But those in the industry I spoke with say that's just not enough. Ben Martins is happy to show off his home.
To move fast. Always my house. I mean, I can come and go as I please. This is my life.
He has personal care aides that visit 4 times a day, 7 days a week, to help with tasks such as feeding him and brushing his teeth.
I treasure my freedom and my independence. And my biggest fear is being put in a group home.
And now, as he's having a harder and harder time finding personal care workers, that fear is a real concern.
I don't know what to do.
Martins used to get his aides through independent living resources, but they're being forced to ease their way out of the personal care services business after losing money on it for the past 6 years.
The problem is, as someone quits, we can never replace them.
Those in the industry say the work is tough, and the going rate of $9 to $11 an hour just isn't enough.
So we're competing with McDonald's and Burger King.
Comfort Keepers is an agency that still provides personal care services to their customers, but they're facing the same hardships as ILR.
When I first started, if we ran an ad, we got 50 to 100 applicants in one ad. If I get one this time when I run it, that's a good ad.
In the proposed state budget, the Medicaid reimbursement rate will be raised by 4% over the next 2 years, which translates into an increase from $16.08 to $16.72 an hour for agencies to cover overhead costs and pay staff.
I don't think that's enough.
No, it is not enough. We need at least 20%. We're not sure what's going to happen to people. We're just really, really concerned.
That concern extends to Martins, who now has new aides from other agencies, but isn't sure what the future holds.
Really want to keep my independence in my home.
Just for some additional perspective on how bad the personal care worker shortage is locally, Comfort Keepers has gone from 400 employees in 2008 down to just about 30 today. And ILR went from serving over 250 people about 8 years ago to 14 today. And as mentioned, they're easing out of offering personal care services altogether.
Thanks a lot, Madeline. And Comfort Keepers currently has about 20 people on their waiting list for personal care services.